Communicating through care. Patient 6 of a hectic day. Miss Susie, I discharged her 5 weeks ago. Why is she back on my schedule? She probably didn't follow through with her home exercise program. Let's see, hip fraction, PT for rehab, got it, no problem. Walk into Miss Susie's room. Hello, it's good to see you again. I'm sure you're so excited to see me too. Meanwhile, Miss Susie is on her recliner. Her meal is untouched. There are used tissues all over the place. Miss Susie raised her gaze towards you and then continues to look out the window. In this 5 seconds of interaction, your poor observational and communication skills have cost you your rapport, and you need to backtrack to reestablish yourself as a trustworthy clinician. Research shows that communication failures are a large contributor to adverse clinical health events and outcomes. In a retrospective review of 14,000 in-hospital deaths, communication errors were found to be the lead cause, twice as frequent as errors due to inadequate clinical skill.
This breakdown in communication occurs before we even say our first words. It occurs before we enter the door to our clinic or the door to our patient room. As humans, it's only natural to become consumed by interpersonal, intrapersonal, and organizational factors throughout our environment. Unfortunately, this can lead to causing hostile work environments and aid in clinician burnout. Many individuals are unaware of their own hostile behaviors, and if we lack the ability to have self-awareness, then we fail to acknowledge that on the other side of the door is our patient. Our patient, who we immediately put at risk to receive the volatile effects of our hostile behaviors. So how can we manage these negative effects and simply drop our baggage at the door? We propose implementing a physical self-check every time we come to that doorway by simply pausing and taking a deep breath. Let's say you had a horrible argument with your spouse before coming to work, and you had back-to-back treatments without any breaks, and now you're overhearing a dispute between your coworkers, and now you have to go on to the next treatment. Before you get to that next patient's room, stop. Take a deep breath in. As you breathe in, acknowledge your own nature and disposition. Acknowledge that it's okay to have those negative feelings. Breathe out. As you exhale, rid yourself of these negative emotions. And before you take that next step, realize that your patient is now the priority.
So now we're in the patient room. Many times when we enter into the patient room and we're trying to optimize patient care, the first thing that we think about is how can we improve what I am saying? We think about, was what I said viewed as culturally sensitive? Did I use people first language? Did my patients even understand my instructions? We become focused on what we were trying to say rather than how we said what we said. Volume, speed, pitch, word emphasis, vocal tone, all play a critical role in our ability to be able to communicate. Words communicate the topic that we are discussing, but vocal tone communicates the feelings and emotions behind what we are saying. Up to 40% of what we communicate can be demonstrated through the vocal tone that we use. Thus, miscommunication is not just through word use and body language, but it's also through inappropriate use of vocal tone and how we say what we do. Our tone can tell our patients that we're busy, that we're frustrated, that we're happy with the progress that they're making. Being able to monitor our vocal tone requires for us to be able to be in tune with ourselves. It requires us to do, as Stevie said, to leave the distractions at the doorstep in order to make the patient our priority. So So how do we begin to do this? What steps should we be considering or thinking about as we enter into the patient's room? Consider these questions. 1, does my word emphasis match the message that I am trying to communicate when I am giving directions? 2, does my vocal tone match the presence, the emotional presence of my patient in the room? 3, does my vocal tone appear to be genuine and believable to my patient? And 4, does my patient appear to be connected to what I am saying and what I am communicating at the time? In order for us to effectively use vocal tone, we must be self-aware and conscious of the environment around us. It's something subtle, it's something quick, it's something easy to miss, but as clinicians, it is vital for us to be able to master the skill set, because it can be the difference between us developing a strong patient relationship or a weak patient-provider relationship.
Pausing, taking a moment, considering our tone. They seem like simple concepts, right? Truth of the matter though, in the clinical setting, we often tend to focus on what didn't go right. Early on, we're taught to be mindful and incorporate mindfulness into our patient care. But what does mindfulness even mean? Mindfulness is an umbrella term for a variety of concepts that are applicable to multiple aspects of patient care. So how do we, as novice clinicians, even begin to approach that? What can we start doing now? I want you guys to think mindfulness equals reflection. A study on the use of reflection in clinical decision-making says that experts are 3 to 4 times more likely to reflect on prior experiences and professional development. So when that session didn't go as you wanted, think about your performance as a professional. Did you leave it at the door? How could you have said things differently? How was your tone? What about your patient? Consider their performance, their cultural differences, their perspectives, pretty much everything we've learned in the class this semester, and that could be applicable to your patient. It all comes down to how could I have done that differently and what can I do next time to make it better? Reflection requires active participation and commitment, aka time. Even if you start with one patient at the end of the day, it'll become a habit and you will consider multiple patient interactions, and eventually you'll start reflecting not on just what went wrong, but just everything in the clinical setting. Reflection must become a reflexive practice. It's the first stepping stone in becoming a mindful clinician. Reflection allows us to be aware of ourselves, our perspectives, our ideas, our current state of being. It helps us connect with others, our patients, their caretakers, our coworkers, anyone involved in providing optimal patient care. And that ability to connect is crucial to being an effective communicator and ultimately providing efficient and quality patient care. Now let's reflect on Miss Susie one more time.
Patient 6 of a hectic day, Miss Susie. I discharged her 5 weeks ago. I wonder why she's back on my schedule. Hip fracture, PT for rehab. Can't imagine that she's thrilled to be back here, especially after we worked so hard to work on her strengthening last time. Knock on the door, I walk in. Miss Susie, how are you doing today? I assessed the situation. I saw the tissues all over the place. I saw that her meal was untouched. I have just opened the door for communication. She looks at you and begins to tell you about the last 2 weeks that have been extremely hard, starting with her husband's recent diagnosis of cancer. Extensive research has shown that no matter how knowledgeable a clinician might be, if he or she is not able to open good communication with the patient, he or she may be of no help, and that quote is on your business card. So how can we care for our patients? Communication by checking yourself at the door, reflection, and efficiency. So let's revisit this interaction with Miss Susie again. Take 1. The first time I walked into Miss Susie's room abruptly without even assessing the situation. I failed to check myself at the door. I addressed my patient in an aggressive tone that was inappropriate for the situation. I failed with efficiency. I did not notice the signs of distress, from the tissues in the room to Miss Susie's demeanor. I was not present. I failed at being mindful. Take 2. I knocked on the door before entering the room. My visual observation directed my next steps. I succeeded at checking myself at the door. I walked over to the recliner, got on her level, and addressed her in a softer voice. I succeeded at being effective. I took the time to address the concerns of the whole patient. I succeeded at being mindful. In both scenarios, one thing didn't change. I was still having a hectic day. She was patient number 6. However, the difference was in my attitude that directed the care of my patient. So remember care, communication,
At the door.
Reflection.
Efficiency.
care.
Care.